Good afternoon. Today, on the occasion, we are celebrating a Brain Awareness Week, and this they are accompanying me is Dr. Pawan Kumar Verma from the Department of Neurosurgery, and I'm Dr. Ruchika Tandon from the Department of Neurology at Sanjay Gandhi Postgraduate Institute of Medical Sciences, and the we shall be talking about deep brain stimulation. Uh, I shall be talking on the medical aspects, and Dr. Pawan shall be focusing on the surgical aspects on DBS or deep brain stimulation. Deep brain stimulation is a part of what we actually called a neuromodulation system. Neuromodulation is a term which means that something is being modified or modulated inside the brain or inside the nervous system per se. And Now we shall be trying to make this talk for significant for lay people as well as the clinicians and physicians and surgeons and so on. So I'll try to make it as lucid as possible. Neuromodulation is something which refers to the modification of the brain, as I've said, and they could be its usefulness could be in two aspects. First, for the management of the neurological problems, as we shall see in the subsequent slides, and secondly, for the non-neurological causes also, like obstructive sleep apnea, the people who snore, and also for certain cardiac problems, heart problems. Deep brain stimulation, or DBS as we call it, is a prototype of neuromodulation, the one which is the most popular thing. History dates back to 40th AD, in which a physician of Roman Emperor Claudius named Lago, he first attempted to do some sort of neuromodulation by putting certain leads in the certain giving certain electrical stimulation to the brain. In 1952, Joe Delgado implanted first intracranial leads which were joined to a certain receiver. In 1960s, human trials were undergone and stimulation of deeper cortical structures of the brain was done. In 1922 to 1985, something which was approaching the present scenario of deep brain stimulation was undertaken by Cooper. Cerebellar stimulation was tried for spasticity, for cerebral palsy, and the deep brain stimulation of thalamus or internal capsule was tried for tremors, spasticity, dystonia. In 1987, again, Benbit et al. Did some stimulation of the brain, and Pollack in 1993 attempted the deep brain stimulation for Parkinson's disease, which is the most popular indication for deep brain stimulation. How does this deep brain stimulation work? First of all, I would like to emphasize that deep brain stimulation is certain thing which is usually tried after the drug treatment for particular disease fails, or the drug treatment is effective, but then the dose is being increased, or the side effects or the adverse effects of the medicines which a person is taking are unbearable, or they are quite some noticeable, and so the person wishes to have certain better options. So it is a second option after the drug treatment for many of these diseases. How it acts. Now, this is what is known as a neuron or the nerve cell. These are two nerve cells. They are connected to each other by means of what is called a synapse. And from this, the electrical activity basically is propagated from through this nerve, then by means of chemical synapse to the other nerve or neuron, and then here somewhere might be the target organ on which this nerve will is acting. So the this when we are attempting the deep brain stimulation, first of all, the mechanism could be that we are somehow blocking this vicious circle which is taking place, in which the nerves are stimulating, neurons are being stimulated, the target organ is stimulated, and then some circle is forming in which this keeps on repeating. So for example, any muscle which is contracting in cases of dystonia, like, so that will keep on contracting, or it will have lead to a sustained kind of a contraction. So we have to break this process somehow. So the disruption of synchronized oscillations and the pathological circuits is one thing which we are attempting. The other mechanism could be that, for example, this nerve is conducting, and so while in when once this it is conducting electric current, it is in a state of depolarization. So we are blocking the depolarization of this nerve at certain stage locally. So that could be the other mechanism by which deep brain stimulation works. The third mechanism could be that once now this could be the first neuron could be excitatory to the second one, that is the presynaptic one could be an excitatory one. So it in certain things in which the stimulation of the target organ is less, in which in this we can attempt to cause excitation of this afferent axon, and this will lead to the activation of the entire process, and this could be the third mechanism of how the deep brain stimulation works. Then it could be by inhibiting the cell body, the function of the cell body. The fifth mechanism could be that in long term, people have found out that it can lead to increase in the formation of the neurons or synapses, that which is what is known as neurogenesis or neuroplasticity. And now we all know that neurogenesis, or the formation of nerves and the synapses, that can keep on throughout the life of a person. There's no It's not that after a certain stage of life or at a certain age this process does not stop actually. So it has been found that certain growth factors and genes might be actually modified by deep brain stimulation. So these are proposed mechanisms of actions. Coming to the indications, in adults the most common indications are the Parkinson's disease, dystonia, essential tremors, drug-resistant epilepsy, and chronic and severe OCD, obsessive compulsive disorder. And these are actually the FDA-approved indications. But there are certain other indications in which people are trying DBS. Worldwide, it is being tried. And for the adults, these are Parkinson plus syndromes, that is syndromes of having Parkinsonism other than what is in the idiopathic Parkinson's disease, like it could be CBD, it could be the PSP or progressive supranuclear palsy, or it could be the multiple system atrophy. So these are some other indications in which at few places deep brain stimulation is being tried. People are, though it is approved for OC, obsessive compulsive disorders, but in certain other psychiatric conditions also, like depression, eating disorders, etc., it is being tried. For chronic pain, actually it was initially started anything which, since pain is one thing which is very troublesome for people, so initially it was for chronic pain that and this deep brain stimulation was initially tried. So that is coming to the history. So that is being revived, and for chronic pain at different areas, people are trying the deep brain stimulation, especially for post-stroke pain, for obstructive sleep apnea, snoring problem, chronic headaches, trigeminal neuralgia, multiple pain due to multiple sclerosis, and for some other movement disorders like chorea, tinnitus, Alzheimer's disease, urinary bowel and bladder, even bladder and bowel incontinence, etc. It is being tried. For children per se, though there is less experience, but still it can be used for dystonia, And then certain things like drug-resistant epilepsy, neuronal ion accumulation, Leschnian syndrome, Tourette syndrome, in which the person is having troublesome tics. And in juvenile Parkinson's disease, again, it is being studied. The most common indication, as we all know, is for the Parkinson's disease per se. Now, indications are that if a person is suffering from Parkinson's disease and the disease duration is more than or equal to 4 years, then we can think of going for a neuromodulation procedure or DBS. The criteria is that a person should be responsive to levodopa, and usually more than 50% or 30 to 50% response after giving in the improvement in the UPDRS scale after administering levodopa. For patients or like people who are suffering from Parkinson's disease, the thing is that if you are responding to levo after taking levodopa, if your symptoms are improved quite a lot, around 50% or more than half improvement is there, then you are a good candidate for deep brain stimulation. But then why should a person go for deep brain stimulation if the drug is effective? So for that, the answer is that after a certain stage, usually 5 years or so, the levodopa responsiveness gradually weans off. It starts decreasing. And even if it does not decrease, then certain other things they come up, like certain troublesome things, like some movements, which may be called troublesome movements, which might be interfering with day-to-day activities, which are known as drug-induced dyskinesias, or motor fluctuations, which means that a person might be taking a drug, it could be effective for some time, and after that, even if the drug levels are there in the blood, it fails to show its good effects. So that is called an off state. So it's just like a switch that a person is you are switching on once you are taking the levodopa, but even if the medicine is there in the blood, gradually the action starts weaning off. So that is on off phenomena, and at times it becomes very erratic that people don't know when to take their medicines or uh, at what time. So when this stage comes, then it is a good indication for going for a TBS. If you are intolerant to the basic medicines like dopaminergic drugs, levodopa, syndopa, etc., and other dopaminergic drugs, now it is something which will be effective for elderly people as well as younger people. And the but what is and the thing in which we are doing it for Parkinson's disease, so we have to rule out certain other things like Parkinson plus syndromes, which means that the presence of certain autonomic features or the presence of postural imbalance, if there is certain impairment, if there is the presence of certain neurocognitive things like memory is impaired, or in the presence of depression, psychosis, etc., it is usually not done. It is These are all relative contraindications. So after the management of depression and psychosis, maybe we can go for deep brain stimulation, but it is for that time, because the person has to cooperate. So the he has to be of the level in which he or she should be able to cooperate. So depression and psychosis must be controlled by the time these are attempted. And then they should lack of social support again is a contraindication, because then there are several things which have to be done at the level of family also. So coming to the mechanisms in which in the Parkinson's disease, dopamine depletion is a thing which leads to spontaneous fluctuations of beta activity. This is certain activity in the brain. So it has been found that once this beta activity fluctuates, there is on its own that occurs in cases that is responsible for causing slow or diminished movements, slowing of movements, which is a feature of Parkinson's disease. So what and then the changes, there is certain gamma range which is in the high frequency oscillation. So that has been observed once we are giving dopamine to the person. So basically the electrical activity of the brain has been found to be altered in cases of Parkinson's disease, and after giving dopamine, this activity again undergoes certain changes or maybe tries to normalize. And so this is what is proposed that deep brain stimulation does to the brain. It tries to normalize the fluctuation of these activities, electrical activities of the brain cells. The STN is a site which is usually utilized for Parkinson's disease. It is there deep inside the brain, the subthalamic nucleus, in which certain kind of frequencies are given. Now, for tremor management, this certain higher frequency is used, and for other indications, certain lower frequencies ranges may be used. And then globus pallidus. This is the other portion of the basal ganglia of the brain in which the stimulation might be done, and this area is actually better. It is indicated if the person is having dyskinesia, so this might be a good option. But the STN-DBS is the one which is more often used. It works for bradykinesia, the slowness of movements, rigidity, tremors, as well as the this dyskinesia. So it works on both the things. So it is definitely, but then now the studies, people are showing that both of these can be used. And there is certain thing called direct pathway, which most of the physicians are familiar with, which is occurs in the basal ganglia. Now, this direct pathway basically means that it is actually an excitatory. The end result is excitatory, while in cases of indirect pathway, the end result is inhibitory. So it is these changes in these pathways which are responsible for beneficial effects in the deep brain stimulation. Now, what is the procedure? Now, though the procedure, the surgical aspect shall be covered subsequently, but just a brief idea that certain kinds of electrodes are implanted. Now, these are quite big, actually small ones are implanted in certain area of the brain. And then the wires are on one side, both the sides. We can do a bilateral deep brain stimulation or a unilateral. Usually it is done on both the sides for Parkinson's disease. And these wires and or called electrodes, they are implanted into the deep structure, that particular portion of the brain called subthalamic nucleus or STN. And from this, a wire shall be connected beneath the skin. It shall be connected to the battery, or this is what is thing which is resembling a pacemaker. So this pacemaker is implanted in the chest, and it is connected to the area of the brain. So this basically this pacemaker is giving impulses at these frequencies which we had seen, and to this portion of the brain. And so it can be switched on, and the stimulation can be switched, current can be switched on or switched off by the person himself or herself, as well as the treating physician. And that is done by means of a remote. And then earlier there was a thing called late stimulation. So people used to give this deep brain stimulation surgery only if at a very later stage of the disease, probably after 10 years or more. But nowadays the trend is towards stimulating early, and that is because people say that maybe if we stimulate early, though the disease will keep on progressing, but then there could be certain good effects, certain regeneration may be helped in certain areas of the brain. The neuroplasticity may be improved. So that is why people are going for early stimulation. Plus, the results are better once the responsiveness of person to the drugs is good. The advantages are that in cases of advanced Parkinson's disease with unstable levodopa responses, and I had discussed, it can stabilize the medication fluctuations or on-off phenomena, which in other words, it can reduce or halt the involuntary movements or troublesome dyskinesias, which we call certain twisting movements or certain things which are interfering with the day-to-day activities. They can reduce the tremor stiffness, and can improve the slowness which person experiences in day-to-day life. The stimulation of STN and GPI are useful for motor symptoms. That is what we were discussing, these things. In cases of advanced these slowness of movements, rigidity, tremors per se. And thalamus and globus pallidus stimulation can be used for levodopa-induced dyskinesias once they are the most prominent problem. However, we should remember that it is not useful for problems which are not responding to levodopa. If a person is not having good response to dopaminergic agents, then he or she may not have good response to the DBS per se, and it does not delay the progress of disease. So we are not actually targeting the progress. Then another targets, different target sites are being considered nowadays for stimulation. Dysphagia, if a person is having difficulty in swallowing, or the posture is wrong, like if there are certain balance problems, posture or the balance problems, so they might not improve. Latest studies are even showing that for gait and balance deficits, the stimulation of globus pallidus internus (GPI) is gradually gaining acceptance for that. Then cognition and mood are not much affected. Earlier it was said that it may lead to cognitive decline, but now it has been shown that that could be minimal. And or maybe if a person is having cognitive decline earlier, then that may persist later on also. And the depression per se and was is not much affected, but in anxiety people may have an improvement actually. uh, Certain other things like apathy and certain other adverse effects could be experienced by some people. And then there could be there's some benefit on the sleep, and even autonomic symptoms, weight loss, etc. have been shown by people. Adverse effects, if the something has been stimulated other than what is intended. For example, if we have gone laterally, anteriorly, superiorly, that is where internal capsule is there, which is responsible for the movement, so then the movement may be affected. And if we have gone posteriorly, then there could be some sensations, paresthesias, or some abnormal pinprick kind of feeling could be there. If the third nerve, the one which is responsible for these certain eye movements, if that has been involved, then eye movements could be affected or visual changes could be there. Then if red nucleus, there could be certain nausea, vomiting. If limbic area, which is responsible for mood, so mood and personality changes might be there. But they usually, in that case, usually we can go for modification of that site can be changed. Since DBS is a reversible process, the good thing is that it can be reversed. Once we take out the lead, the changes are not permanent, like in cases of other surgeries like lesionectomy, etc., in which we remove certain portion of the brain. In this, we are not removing anything, only stimulation is being done. And then things are advancing day by day. A closed loop system is coming, certain directional leads which are better at targeting the exact area. And then certain things, if we stimulate it exactly at the area where it is intended, then probably less battery would be used. So less current would be needed, so less the battery would be, life would be preserved for a longer time. Plus stimulation induced adverse effects may be reduced. Now again, pacemakers are coming, which are stimulating simultaneously several, around 16 electrode channels in brain. Programming from remote location, like till now it is there that a person has to come to the chamber of the doctor, and from there the programming is done, or maybe they can learn to do the programming, partial programming themselves. But then now programming from remote location is becoming possible. Robotic deep brain stimulation is coming up, and the then DBS per se for GPI as well as STN, they are approved by the FDA. It has been found that in a study that cognitive symptoms have not improved, but then visual hallucinations have improved if we have stimulated the nucleus basalis of Maynard. Maybe for the Alzheimer's disease, people are studying its role. Then there are certain other areas which are being targeted, like pedunculopontine nucleus or PPN for gait and balance. It may improve gait and balance to a certain extent. Substantia nigra pars reticulata portion also. Then things are coming for non-motor symptoms. Non-motor symptom is something like sleep disturbance, constipation, autonomic things, which are the REM behavior disorder, certain things which are restless leg syndrome, in which a person has a tendency to move the legs, especially at night time. So these things are also being targeted by people. People are trying them for these complications also of Parkinson's disease. Now, the second important indication which is approved by FDA is for dystonia, or abnormal twisting kind of movements of the limbs. And it has been seen that there is a decreased activity of the ventro-intermediate nucleus or the ventro-posterior nuclei of the thalamus. And in these people who are having this abnormal, this dystonic posturing, the representation of this motor area is more in the thalamic region. So these changes do occur in the brain in these people, abnormal changes. So and then pallidal, and so what deep brain stimulation might be disrupting this kind of the thalamic activity. It could be disrupting the circuit which forms between cortex, basal ganglia, thalamic, and thalamus and cortex, like in cases of direct and indirect pathways which we had seen. So this high frequency DBS disrupts these pathways, and thereby its role in treating the dystonia. It has been found to the contraindications, like in cases of PD Parkinson's, are that there should be no cognitive dysfunction, uncontrolled depression, psychosis per se, or if a person is having fixed certain contractures have already developed, then dystonia might not improve much. Walking might not, of a person if it is in lower limbs, might not improve much. MRI of the brain has to be normal, and in these dystonia, it is the thalamic, this DBS, which is more found to be more effective. And the than GPI DBS, especially in cases of writer's cramp, and the deep anterior cerebellar lobe DBS is also being tried in children with CP, the cerebral palsy. For epilepsy, again, this has been recently approved by FDA for the drug-resistant epilepsy, which means that seizures which are not controlled on two or more than two anti-seizure medications in those people, and it is interfering with the quality of life, and the DBS may be tried. In this, the target is the anterior nucleus of thalamus. For essential tremors, sometimes these are certain kind of tremors which people experience, and they increase with age, and usually there is a family history. So these, though they might not be needing much of the medications in many cases, but then in certain people are very resistant to drugs, and they might be in certain professions in which they have to appear in public, and they find the tremors to be very troublesome. In those cases, once the person is resistant to drugs, then only there is an indication for going for deep brain stimulation. It is seen that certain pathological oscillations which are recorded in the motor cortex and in the thalamus, in the pathway which is connected to the connecting the cortex and the thalamus, um, as well as the cerebellothalamic bursting inputs that may cause these tremor oscillations, and they are disrupted. We are trying to break this chain, and certain astrocytes are also being modified, astrocytic activity. The WIM nucleus of thalamus and cerebellothalamic tract is what is targeted. And once people are resistant to tremors, to medications, then we can go for the surgical option. Then pain is another thing in which people are attempting to go for deep brain stimulation. The presence of chronic pain, usually related to the sensory portion of the thalamus, but there are other targets also. Now, adverse effects could be related to the surgical problem, which could lead because of certain vessel might be injured, so that could be certain hemorrhage or infections or things like that, or it would be related to the some hardware problem if a wire breaks or something like that, or they could be because the area has not been targeted properly, in which case we can definitely take the lead out and redo the procedure. So the something could like the speech can get altered, or some people can have abnormalities in walking, the gait could get altered. So though the indications for deep brain stimulations are several and they are expanding every day, but then these are the few important ones in which are actually the approved indications. The results of a patient, one of the patients of who has undergone deep brain stimulation at our center. So this is what he used to look before undergoing this stimulation surgery. He used to have lot of dyskinesias, these abnormal movements while walking, and this was after taking the levodopa tablet, which he while he was being given this tablet. And this shows the same person on the day of surgery. And as we can see, the dyskinesias, those abnormal movements have disappeared almost completely. Same person while sitting, he is having lots of problem in doing his day-to-day activities, and he's feeling quite embarrassed because of these movements, trying to suppress them as much as possible. So that was before having undergoing deep brain stimulation, and this is after undergoing this the same day. He is sitting quite comfortably. So just to summarize, the deep brain stimulation is something which is a reversible procedure, so we don't have to worry that what will happen if it is not successful, or can I if people usually ask that can it be reversed, or does it damage some portion of the brain permanently. So that the answer is no. It does not damage any portion. It is fully reversible procedure, though it may need a surgery, definitely. It is an awake procedure, and it is quite effective. So for the doctors when to refer the person, it is important to know that if it is in the initial stages when the surgery is going to be effective, then it is and once the person is having affect levodopa responsiveness, then only DBS is also going to work in cases of Parkinson's disease. But that doesn't mean that initially, as soon as the person is diagnosed, it means that person has to be around 4 or 5 years have to around 4 years have to the person may have taken medicines, then and that is the ideal time, or maybe they can plan it later on, but then that is the ideal time to undergo deep brain stimulation. In cases of dystonia, tremors, and other conditions, once the response to person is taking lots of medications having, and still the response is not proper, and that is the time to refer. And for patients or like public per se, when to consult for DBS, so the right to consult as soon as a person is being diagnosed to have these neurological problems, it is good to consult doctors. But it doesn't mean that you are going to get deep brain stimulation if you are consulting. Only if you are eligible for deep brain stimulation, that will be done. For that we have to rule out certain conditions, uh, and then what to expect during the pre-op period. So for pre-op evaluation, we may have to do a certain cognition test, which means test for certain memory, and the also screening for depression to see that you will be able to cooperate or handle the surgery and the things accompanying things. And with this, I would like to conclude, and I would like to thank um, our institute for this opportunity, and also thanks to the Indian Academy of Neurology for the this idea of brain week awareness program. And with this, I would like to hand over to Dr. Pawan Kumar Verma, who is a neurosurgeon actively involved in this deep brain stimulation program